Doing nasotracheal care today, which is doing a nasotracheal suctioning. Prior to doing any suctioning on your patient, you do want to look at the chart and make sure that there are no contradictions going on, no bleeding disorder, no laryngospasm, no epiglottitis at all going on. We've looked at our patient chart to verify that, and we do feel it's time to go ahead and suction. So we're going to go ahead and gain permission in the room by knocking on the door, letting the patient tell us to come in. Introduce ourselves. Hi, I'm Kimberly from Respiratory Therapy. I'm a respiratory therapy student. We're going to go ahead and set our suction catheter kit down right here. Go ahead and wash our hands, dry off, put that in the trash. So upon taking everything out of the kit, I'm going to place it here and here. We're going to take our suction tubing, go ahead and hook it to our suction cap. Just like that, make sure. All right. So we're going to take a drape and put upon that patient because they're on an oxygen mask. I'm just looking at normal breathing. We'll lift that up real quick. Put our drape up under that and lay our tubing there. So since they are on that, we're going to beef them up to 100%. All right. So we want to take our clean glove and place it on our non-dominant, or excuse me, we're going to take our clean glove and place it on our dominant hand. All right. While we do that, we're going to take the steering glove that came in the kit and put it on our non-dominant hand, which for me is going to be my left hand. All right. So then I'm going to take, like I said, an nasal saline, pour it at the bottom of the tray. We're going to hook up our suction catheter to our suction tubing. Okay. We're going to take and put a little sterile water here, this nasal saline, and run it through this catheter. We're going to do that twice. All right, so then we're going to go ahead and remove our mask. We're going to take the suction catheter. You want to follow the person's nose going around. All the way down, ears, down to the septum. All right, we didn't feel any resistance, which is good. We're going to go ahead and suction the catheter with a patient 10 to 15 seconds. After then, you're going to gently remove the catheter, pulling back, kind of twisting as you pull back. We're going to go ahead and clean out this catheter with our normal saline water head at the bottom of the tray. We're going to wrap our catheter around in our, like I said, our clean hand. Pull that together to throw that away. Take a sterile glove off. Gather that, put it together. We're going to go ahead and disconnect our tubing, suction tubing. We're going to place our patient's mask back on them. Remember they're at 100%, so we're going to have to adjust them back down to the liter flow they were on. And then we're going to go ahead and assess our patient, get their cardiopulmonary status. We're going to go ahead, clean up our area, find out anything we can do prior to leaving out of the patient's room. Go ahead and chart so we can verify, like, hey, come do our comparisons with the patient's last things was cardiopulmonary status prior to suction them and what they are after suction.